I became certified as an EMT and a firefighter. Then I would be able to show up at someone's house that had maybe fallen and possibly broken a hip. I would get to care for them as an EMT in the back of the ambulance. To a lot of times, I got to be the one that walked them out of our rehab facility and helped them into a car to go home and live independently.
You're listening to Hearts of Excellence, brought to you by Majestic Care, where real stories from long-term care come to life. Well, hello everyone, and to our listeners, welcome to the Hearts of Excellence podcast. We are so glad that you are here listening, and we're grateful that all of our new listeners have joined us. This podcast is brought to you by Majestic Care, where we believe excellence starts with the experience we create for those we serve. I'm excited to introduce all of our listeners to Brittany See. She is a member of our reimbursement team. She has a strong clinical background, which I'm excited to hear more about today. And under 12 months that you were with us in that time frame, you already were making a huge impact by bridging your clinical expertise with operational processes. So in this episode today, we're going to explore how your background, Brittany, informs your work, your lessons that you've learned, transitioning from that direct patient care to more of administrative and that reimbursement role. So I also want to hear today about your insights that you bring to supporting the quality of care to our residents behind the scenes. So welcome.
Thank you. It is a pleasure to be here with you today.
We are so excited. We love this. We love
This is
this
the best part.
podcast.
This is fun.
We love it. And also, I think it's worth mentioning, this is the first podcast we recorded in our new podcast
studio.
Yay! Exciting. Oh my gosh. Obviously, we're excited about that.
Yeah.
So,
You
Paul,
guys did a great job.
yeah. Thank you to my colleagues and all of us that have made this. You had the vision, and we worked together to make it happen. And I will say, as our listeners see it, because this is a video and they can listen to it, but you'll probably see some changes along the way as we enhance this space and just make it more elevated and represent our brand. So today is our very first one, and this actually is Paul's office, so
Yeah.
it's really, really cool.
We're going to call it the multi-purpose room.
The multi-purpose room, and people are probably like, wait, where's the desk? Well, for those listening, this room is extremely large, so this is just one aspect of the room and more to come. But thank you, Paul, for allowing us to use this space.
Well, this is such a benefit to our organization to reach others about truly what we love. And if anybody would have seen our last one, it was a little cube. So when you get everybody in there, so there's us three, then other people from production, and so there's 5, 6 people, like you're almost on top of each other, and it gets really awkward. So when we were looking at the space, it was like, where else can we do this? And it's like, I travel so much, I'm not always here. So let's make this a multi-purpose room, and we'll make it work.
And it's beautiful. It turned out perfect.
Yes, thank you. Yeah, it does feel nice. We're not crammed on top of each other, and it's a new experience, which we're all about elevating the experience here. Well, if you guys are okay with it, I'm going to dive into the conversation. We've got a lot to cover, and I'm really excited about it. All right, Brittany, can you tell us a little bit about your professional background and what led you to patient care?
Ooh, this is a strong opener. I love it. From a young age, I really just knew that I wanted to help others. It was really a big driving force for me from a very young perspective. When I was in high school, I tore both my ACLs playing sports, and that required lots of surgery and was really my first introduction into the rehab world. And that experience was just something that never left me. It just stuck with me. So when college rolled around, I decided I was going to take that as a career path. So I went to Indiana University, received a Bachelor of Science degree in kinesiology, and then quickly jumped right into occupational therapy realm. And it was so neat. I'll never forget. I think my first year in the real career world, I think I had 17 W-2s. This is no lie.
Oh my gosh. So that is
when
a
I say
lot.
I dove right in. So with that being said, let me explain. I took it on with a lot of passion and pride, and I worked a lot of PRN, per request needed jobs. So I was experiencing acute care. I was doing some outpatient. I had seen some home health patients. I was seeing pediatrics every day. I was kind of that go-to, hey, we need a therapist in the area. And I was like, I'll be there, right? So the thing that kept me grounded in everything, my full-time position was in a skilled nursing facility. So I spent majority of my time there, and that is really where I developed my pride and passion for the geriatric community. Now, as all this is happening, a lot of moving pieces in life, this is also about the time that I met my husband, now husband, and he was passionately driven in the public safety realm. And uniquely enough, on top of all the other news I had going on, I became certified as an EMT and a firefighter.
Whoa.
So
I did not expect that.
Opposite spectrum of care.
Cool.
So very neat. From my perspective of that, there was weekends where we'd be on the ambulance together. We'd have tragic trauma events, and I would be able to show up at someone's house that had maybe fallen and possibly broken a hip. I would get to care for them as an EMT in the back of the ambulance, telling them and comforting them to what could come next, right? We'd take them to the hospital, and then come Monday, a lot of times they were a referral into the place I was working at the time. So it was so amazing to be able to see that full aspect of care. I'd seen them at their very worst, when they were most vulnerable, when they were laying on a floor and felt the end of the world was coming down on their shoulders, to a lot of times I got to be the one that walked them out of our rehab facility and helped them into a car to go home and live independently. And that experience is really what just founded me and a lot of the pride that I take in care. It really did.
Wow.
Cool.
I'm
Very neat,
speechless.
huh?
That is incredible, Brittany. I don't know that I've ever met any other healthcare provider or clinician that has served as, that EMT or that firefighter or you name it, and then seen it full circle. That's really awesome.
It was just a joyous experience, and, just rounded me in so many different directions. And, the other aspect of that is that was so early in my career to be able to experience that. I knew the value of it, but I didn't appreciate it as much as what I do now, seeing the full picture of it.
Was there a turning point in that made you realize you wanted to explore a role beyond patient care?
Yeah. So, I was less than a year into my career, and a mentor, currently she was the director of rehab, overseeing the rehab department for the facility I was working at. She came to me and she said, Brittany, I'm going to stay with the same company, but there's a position closer to my home and it makes sense mileage for me to go there. And I want you to be the director of rehab at this building. And I immediately was like, me? I'm less than a year into this. I'm still learning. Why would you want me? And she overconfidently assured me that I was the right person for that position. And at the time, I'm thinking, is this a trap? Am I just the only one willing to jump into this, right? I was kind of tossed up to believe her or to not. Well, I dove right in. I trusted her as a mentor, and she was just a great support system for me. So I took on that leadership role, and immediately my entire perspective changed. So I had gone from working all those different jobs, providing care in so many different ways and passionately driving that care, to now I had the opportunity to take what I was doing and multiply it times a team of 10 or 12. So just the good that I was doing, I could help support a team to do that much more good, right? And it just immediately hit me that I'm not only passionate about care, I want to be a leader because I can just quantify what we're doing in such a good, positive impact way for the world. So it came right into me.
Did you ever find, because we have similar paths, being therapists and went into the director of rehab, and then how to get therapists to look past, because when you would come, like if you were my director of rehab, I see you coming to me about numbers versus about passion that you're sharing right now, the passion you have towards the care for residents. And sometimes I think they lost sight of that passion, who we are. Like, yes, I know there's numbers, there's that. I didn't write the system, this Medicare wrote it, but the passion to drive for the actual care. Did you ever find that was a challenge to try to get the balance those two worlds and show that I am about the care of the residents? Yes, there's the financial side, but this is what we have to do to drive care.
Absolutely. And I think that's part of what's molded me to be a good fit where I'm at now, because, there was something that I always said, and for therapists that's worked with me before, I always stayed tried and true to our job. What we're here to do is to provide good care to our residents. If we are providing that care, if we are providing that quality, everything else will align and follow, because we're getting reimbursed. Our operational standard is to work towards that good patient care. So if we start there and we keep that as our North Fall, everything else should align. Now, yes, there's challenges. And yes, at the time I was an occupational therapy assistant too. So, and I was young in my position. I was working with therapists that had been in that building for 12, 15 years, right? So there was this, I'm the newbie, I'm less experienced, but I'm also leading a team. And, it took me some time to settle into my path. But because of that experience, it really molded me into the direction of where I'm at now.
Thank you for sharing that.
Yeah.
That's a great insight. What was it like starting at Majestic Care? What surprised you most about your new role?
So let me ask this, is this her role now, or is this back when she was
Yeah.
there?
So fun fact.
Pick your journey, pick your
it's okay.
adventure.
No, I'll explain it all out. Yeah. So for those of you listening, I have had the pleasure of working alongside Majestic Care since the very beginning, the very, very beginning. Yeah. I was a director of rehab in one of the facilities that Majestic had initially started with. And I worked for another contract company at that time and partnered alongside a Majestic Care for the past 7 years up until I made the transition to be a part of the family and team. So there's a little back history for everyone. But to get back to the question, you asked what it was like starting for Majestic Care as part of the family and as part of the team. I was so excited and just felt like it was an amazing direction, but I'd be lying if I didn't tell you I was a little overwhelmed and just nerve-wracked. And let me explain some of the context to that. I had grown in the therapy world and grown in my career, and I was currently in a role as Senior Regional Director of Operations. And this is for a large contract rehab provider. And I absolutely loved the people I worked with, and I loved my job. I truly did. And Majestic had came to me and presented some of the offers and the direction and their vision. And I immediately thought, I'm ready to grow. This is an opportunity for me, an opportunity to branch out of just being in that rehab world and to really bring what I can bring to the table across an entire team, an interdisciplinary team, to just enhance the care for each and every resident that we provide. So it didn't take long to get over my nerves, and I jumped right in. As far as what surprised me, it took me a minute to settle, and I can remember coming in, and my title with Majestic Care is Enterprise Reimbursement Strategist. And as I started integrating with the team, which I had known and had presentation with before, I thought, oh my goodness, this is such an intimidating title, right? To come to teams and be like, I'm Brittany See, I'm your new enterprise reimbursement strategist. I was so worried about what the teams were going to think. Oh my gosh, they're going to be like, oh, all she cares about is reimbursement, So I really took time to settle. But the surprising aspect of that was each and every team, as I got to know them, they welcomed my clinical background and just made me feel at home. And really, we found that my clinical background and congruence with that reimbursement and strategist aspect, we really just added so much more value to our discussion, and the teams were just wanting to absorb it. It was an awesome atmosphere to jump right into. So all because of the support of them, but they were great.
Do you see a difference? So day one, I mean, because you've been with, like you said, the company for 7 years, but do you see a difference of growth from the strategy that we've taken on as a company, like where we've seen where we need to continue to grow and develop? Because it is about making sure we capture the care that we're delivering, not just on a reimbursement, because we all can say that, but it's truly capturing the right care at the right time for the right reasons. But have you seen that grow over time since you've been with the
Oh my
company?
gosh, yes. To know where we began, and that's a long stretch with a lot of changes, right? We
Yeah.
had the PDPM model, we got rid of rehab percents, we've been through a lot of state changes, iSNP's now part of our program. There's been a lot of changes over the year. But I've watched the culture just grow. I've watched the structure, the organization come to where we started, and it was messy, as it always is when you start and it's new, right? But then to see where we were then to really be a part of the teams now and hear their conversation, their structure, the talk of our vision and every morning meeting concept, like that's really what's been inspiring about watching that change over the years is we're not where we were 7 years ago. Majestic Care has grown to be a promising perspective of care to each and every one of our residents.
What's cool is your perspective because, again, I always call it the ivory tower. When you sit in the ivory tower, you know, for the listeners, if you would have been into the office pre-renovation, I had a big whiteboard, and you can whiteboard anything out. You can say, we need to enhance clinical conversations around this or whatever, but you can say it and you can put it in place, but you never know how does it really play in the facility.
Right.
Because we've all been there. We've all been at that side. We've all been on that side with a facility where someone can make a decision up here, but it's like, is that really reality? Is it really working when it hits the floor, which that's where it matters the most? We can do whatever up here, but where it really impacts the most is the leaders in the building. And is it a positive or a negative, which it's nice to hear that it actually is improving in a positive way versus being a barrier, because
Yes.
that's the worst thing we could do.
It absolutely is. And I can contest to that time and time again. It's tremendous growth.
Thank you for sharing that, Brittany. It gave me chills, actually, just hearing that. Your journey shows the value of combining clinical and operational knowledge. Now, let's talk about that mix of experience and insight, how that has shaped the work you do every single day.
Sure, and it's everything, honestly and truly. I don't just look at numbers to be numbers. I see the residents behind each number. And because of my clinical background, we've been able to productively challenge and just advocate for accuracy with our coding and crediting the care that we're providing, right? And that's been instrumental that leads us just in a positive way of growth and that perspective. It's not just the data, it's not just the metrics, but behind that data and metrics, there's a patient supporting that. And that's what we deep dive is into them and their care. And that really makes a difference.
Context, right?
Yeah.
And that's our residents.
Yep.
That's the context in any decision or conversation you have, right?
Yeah.
You have to have context. And if you don't, I'm going to challenge, are you bringing value?
Well, the interesting thing is that I think about our journey through like our antipsychotic usage, because again, that's on our quality measures, it's coded on the MDS, it's coded like just everywhere. And having that context, but being a therapist, and especially from an occupational, because I always say occupational therapy bridges speech and PT.
Correct.
So I'm a PTA by background. So looking at this side over here, if you work with a speech pathologist, they're over here, but you guys touch both sides. You can do cognition, you can do swallowing, you can do activities of daily living, which tie very heavily into the PT side. So I feel like you guys have been a very good bridge. But when I think about somebody on antipsychotic and how do we really reduce and get them off those meds, because they're not good meds for the right reason, for the right purpose, yes, I get it. But it shouldn't be at the levels that we were carrying them at.
Right.
And we've seen such tremendous turnaround in that. And I feel confident to say on this is that by the work you've done, by the work Dr. Russell's doing, our whole clinical team, we're making it for the right reason. We're not just giving someone a diagnosis just to get it off our QMs. We're not just giving them another med just to deal with this. We're truly looking at them and how can we get therapy involved? How can we drive excellent care? for the right reason versus just through polypharmacy.
Well, in the clinical application, you have a whole team reviewing that care, and each member on that team has a specialty, right? And brings a story, a background, just like my background, into the presence of our conversations. And that is what strongly guides us, right? Like you talked about with the antipsychotics, there's so much more that we can do than just pass a pill and yes, it calms the results. That's not going to help us with the longevity of care. But when we put that whole team together and look at it as the full clinical view, we can put together a pathway for that patient that helps that patient to be successful in that pathway and get and achieve good outcomes. And I think that's just really what guides all of us in that. It truly does.
What's a challenge you faced in your role that taught you something new about care, people, or processes?
So I think just a big challenge in general is just sometimes shifting mindset. And I want to talk about this a little bit in context. I'll give an example. All too often, we see documentation and coding as a task, something that has to be done, right? And something that we've really branched out and put education into our teams is it's more than a task. What you document, what you code matters. And just as we were talking, that's the support system that helps us with that clinical pathway for those residents. If we don't get the documentation and coding right, then we're going to be under-resourced and we're not necessarily going to be meeting the needs of that resident. It has to start there so we can get that full picture into it. And, as far as working through that challenge, right, I think I've grown in a lot of aspects as I've set out and endeavored in this, is the fact that, communication, team education is instrumental. But something I've learned is as a leader, you have to come to the team where they are in their direction. And something that's really shown strong being with the entire enterprise, I see a lot of the teams and I've realized that just like our patients, no two patients are alike. Well, no two teams are ever alike, right? They each have their different barriers. They each have their different challenges. If I come in and try to consistently do the same thing, yes, we have our foundation and we have that direction, but sometimes we have to adapt and mold so that we can meet that team at their level so that we continue to grow in that positive path. So that's been a huge direction for me as we've just seen those challenges and working through that. It's really the strategy behind it.
Oh, absolutely.
Yeah.
So going through a little bit of personal dynamics with a family member in healthcare right now. And, it's interesting as you're talking about, the documentation, the team dynamics, the team meet them where they're at. You want this perfect structure. As a CEO, your goal is you want very strong systems.
Yes.
Because you want the experience to be the same. So let's say Chick-fil-A, right? Because everybody, when you order and when you walk away, they say, my pleasure. So very consistent. So you want the same thing when families experience our services to be the same, or when care team members experience, but that's not always reality, to your point. So it's like, how do you develop that goal and drive that goal to systematic change? Because again, our families are the ones that get caught up in the mix of it all. And it's not always a positive experience, i.e. we went through that this weekend with my brother-in-law. But how do you see when you're working with those teams, meet them where they're at, but also trying to drive to one systematic approach to get that one system outcome that we're driving for so that it's replicable time over time over time versus the new flavor of the month?
Sure. And I think you hold to your systems and have that as your set goal. But sometimes we have a path, right? And we might have to adapt and veer off to get to that systematic goal, right? And it just depends on what the barrier is that we're experiencing at that facility, right? But we still have that same goal to, keep a very structured system. But sometimes that's not the now that we can work towards to maintain our vision, right? So we veer back off, we get that aligned, and then we come right back to that system so that we can get to that final goal. You go around the barrier, you go over the barrier, you go through the barrier. So I think that's been part of the strategy. We don't veer off of those systems too far. We always come back to them, but at sometimes, it's just not that we can keep that adamant structure, we have to get around that barrier to get to that structure. So,
And you and I both grew up in this industry.
yep.
Do you feel like when you hit those barriers, whether it's going around, over, under, through, whatever way you have to, do you feel like there's the support of the organization to do that? Because again, we all grew up in this, and people are very creative and they will figure out ways to do what they have to do to get the job done. And I think maybe that's where sometimes the systems get fractured, and because again, they don't feel supported. They don't feel like they're getting what they need. Do you feel like, and again, we believe here at Heart of Excellence is it's real.
Yeah, it's real.
Sometimes it doesn't happen. Sometimes we miss it so hard to the bad. But do you feel like that happens, and that if that's happening out there to where people, again, in the trenches are feeling supported, they're getting what they need, or are they not? And that's something we have to challenge ourselves and be okay with, and answer it, say, no, they don't, and we have to fix it.
Sure. And I think one of the unbelievable qualities of Majestic Care is that support team. It layers, and it's thick layers. And like I've talked about so many times, I'm just one piece of that layer. But when I come to that team that might be having a little bit of a tough time, right? And we may not be able to get to that system the way we want it. It's not just me. Guess what? I'm calling the regional for social services. I'm calling our RAI specialist. I'm calling the director of nursing. I'm calling the regional nurse consultant. And I'm saying, hey guys, let's work together to figure out what to do here. And our teams feel that at a level. We are present in their meetings and their buildings very frequently, and the teams welcome us. It's not like I've worked in some atmospheres where, it's like, oh, your regional's here today, right? Or everybody put your name tag on, clean up your office, make it look better, right? We have a great system where we can walk in just like the next day, and it's not uncommon for us to be in the buildings, so they're comfortable with us, So I feel like that's a strong point in a lot of the buildings is that support is already established and it's part of who we are and what we provide to the team. So,
And it goes back to the culture, right? Because a mentor of mine, his name's Eric Gillis, he used to work for Ensign Group, which is a large national chain of nursing homes, and very large. I mean, they're now on the NASDAQ. I mean, just huge. But he worked there, and I loved when I got to know him. They called their, I'll call it corporate home office, whatever you want to call it, support service. It was a support service office because they never wanted to feel like we were coming down to top down. We're support. We're here to help. He said they never wanted the feeling where people felt like they got caught. We're here to support you. We're here to help you. We're here to help remove barriers. Whatever your challenges are, we're here to help you, not catch you and do the aha. Because that's the worst culture to have.
Oh my, yeah.
Because nobody needs another piece of paper to tell them they messed up.
Yeah, absolutely.
That'll shut them down instantly. So to know that I have someone coming beside me versus coming to put their thumb on top of me is a whole different way of viewpoint.
That's a great call out.
And that culture is just strong across all of our facilities. It really is. So
I always said back when I was a COO, we should never walk in and give a piece of paper to the DD or DNS and walk out. We should say, here's what I found, but we helped you fix it. Now, again, if patterns over time, yes, you look at performance and is it more of a process or a people issue, but you shouldn't just walk out and say here, because I know as a former administrator, I'll just add it to the 20 different pieces of paper on my desk. I'll get to it when I can.
right.
But to know someone can come and help me fix it is huge.
Well, and to your point, Brittany, you overseeing the enterprise, it's not a one size fits all, right? So as us being support, it's okay, here's that goal, and I'm going to have to get to know them because this building is not the same as this building, and we all got to get to our goal. How can we really get to know them to get them there? Because they're all different, right? And it may look different at each one. And at the end of the day, we're all caring humans, but we're caring for other humans too. So it can be challenging, but good conversation. I love it. All right. So has there been a moment recently that reminded you why this work matters?
I have so many experiences where you have those feel-good moments. I mean, for us, it happens almost on a daily basis, to be honest. But just to kind of set an example of something that's recently happened, we were on a Teams call with a team, reviewing data, reviewing the metrics, and something seemed a little off with the team. And I'm going to try to generalize this the best I can. We just wasn't where we potentially had seen as an industry, as an enterprise, or even just state or national average. So we were talking about as a team, deep diving it. And it got to the point where I was like, hey, let's pull up a specific resident that's falling into this scenario and let's deep dive their care. So as a team, we all just started going into it and trying to figure it out. And why is the data not supporting and what's going on and what's the clinical complexities that's happening behind this patient? And as we started deep diving, we noticed there was some gaps in our documentation. And we were able to, as a team, find that, right align that, get our coding and documentation right. And then I immediately watched the team put all that into perspective and change their approach to care for that resident. And that happens from time to time. And those are the reminders that what we do matters, right? It's not just about getting the data right, but the full picture is that resident was seen that day, they were heard that day, and because of that conversation, we were able to provide better care. And that's really, the instrument of challenging sometimes, right? We can't just be okay with a quick response, but we sometimes need a challenge and look deeper into those data, the metric, the statistics that support. So
all this data is flying. Do you see where technology could even enhance it even more? Because again, when I think about back in SOAP note days where you had to write your notes versus a point click system or electronic, things can evolve. They can become barriers, but they also can be enhancements. So do you see like where we could even get more technology or where it would help the team even provide better care because it's coalescing the data better so that we can get to those solutions to give better care?
Absolutely. And Connect has been a prime example of that because in the reimbursement department, prior to Connect, we were on a weekly basis reviewing every single resident where their prior assessment had fell, what HIPS code they fell into. And then if there was a change, we were having to go in, manually code it. And that's where a lot of our data was driven from. It was all hands-on every single week, hours of labor and work, not just from our team, but the reimbursement team. Everyone was hands in and helping us on that. When we branched into Connect, it gave us this whole new opportunity where that is automatically filtered, pulled out of PCC, and then outlined in nice, neat bar graphs for us, right? So it really guides that path of direction. And then to your guidance here, yes, I think that as AI improves and grows and as it really fine tunes, I think it's going to be able to help us to continue to grow in this department because I spend a lot of time deep diving into a lot of that care. AI has the capability to be able to pull that information out for us and really fine tune and guide our paths so that we're not spending a lot of work into the search and find aspect. And Connect's already branching into that. We're already using that aspect. I look for it to continue to grow, though.
I think that's cool because, again, when I think about what we're up against for the next 10, 15, 20 years, or pick the time frame, people can say we need more, right? We need another reimbursement strategist. I hear you, but I can tell you what keeps me up at night. There's just not the people. When you look at population, you look at silver tsunami, but just birth rates and that are down. So, there's just not enough bodies out there to keep. So we're going to have to get more creative with innovating technology to where, okay, this is really helping me focus my attention here because now I don't need to spend my time extrapolating the data. I can use my brain for using the data to drive change, but we have to get some AI, more systems in. I would always advocate as a company for innovation being one of our pillars is how do we continue to push innovation and be a partner where we're willing to even be a test pilot? So we use Connect. If they want to trial us something, hey, we're willing to be a partner with you and trialing it to see how it does work and see if it really does drive change. Because at the end, if it does, it benefits us just like anybody out there in the industry.
Yes, absolutely. And I think it's already been able to let us continue to grow. And I think there's just so many more layers that we can add onto it. And sometimes we have to take what AI produces and we still have to be humans behind
Correct.
it, right?
Right.
And be the factors. But we're already good at that, you know? So this
Yeah.
just adds another additional support system to us. I'm not saying it would ever take away us, our clinical
No.
care, but, you know, it just simplifies it and allows for us to have time in other directions, right? Which is only going to grow us in what we do in caring for our residents.
And that's, I think, the barrier we have to be challenged with in healthcare, especially as leaders, not to find the easy button to continue to change your expense line, but to use the easy button to say, how can I drive better care?
Right.
And
Right.
better care could be, you know, now instead of just Brittany and needing 6 more people, well, Brittany now can get all this data. She doesn't need people to just go extrapolate it because she can get it all here. And now she can use her clinical brain to help really drive clinical care and outcomes for the best of that resident's care versus, okay, well, let's get rid of Brittany, let's get rid of Chelsey, let's get rid of Paul because now AI can, well, no, that's not it.
No.
This is use AI to get rid of, I call it the white noise.
Right.
Yep.
So we can do what we do, and that's take care of the patient.
I love it. I
Too.
love it.
That's
It's
the end of the day.
exciting.
Talk about it all day. Brittany, looking back, what's a lesson from your clinical days that you carry with you into every project or decision?
This one is impactful to me in so many ways, but every resident has a story. And I learned this very early on in my career. It's our responsibility to understand that story. And, you know, I've always used that as a foundation that guides and really allows for me to lead with empathy. I think that's just the power of what we do. You know, it's not just a resident. There's a story behind that resident, and they have a family, and there's so much more to learn about them. And by doing that, it just evolves us into that excellent care model. So that's really it for me. That's what brings it all home and wraps it around. That's something
gold.
that I have kept tried and true to for a very long time now.
And I think too, that's when you know you're in the right space, right? Because we've all in our career, whether it's you want to stay in healthcare or what am I going to do when I grow up, right?
Yeah.
You want to, what do you want to be? Do you want to be a lawyer, a doctor, a nurse, teacher, you name it,
Right.
right? Artist, who knows? But that's what your North Star is. That's how you get back and where you know you belong. That's beautiful.
You know, and again, I think it is. Everybody has a story. And I think that's where, again, the white noise, removing it so everybody can have time to hear the story, because that does drive care differently when you know that side of somebody other than room 112, bed 2.
It makes that connection, right? That's what promotes that empathy, that care, that joy in what you do, right? It bonds that connection between you, that resident, and their family. It's really what pulls it all together in a full picture.
So it's interesting because we just had the pleasure of talking to Dr. Bosey with Qualtrics.
Yeah.
And she has a TED Talk, and I listened to it, and it's all about empathy.
Oh, it's so good.
It's very good. So if you get a chance, Dr. Bosey, and I know we talk about podcasts.
I was going to say, I'm
so,
just learning how to use
Well,
podcasts.
I'll send it to you.
and I'm just learning how to do TED Talk. So,
Yeah.
but it's very much, like you said, it's about the story, and it's about how do we become and utilize being more empathetic. So it was a very cool TED Talk.
It was, that was a great conversation. I'll share a quick personal story. I oftentimes get the question, why don't you do nursing anymore? And my answer is always because my favorite part about being a nurse was the relationships I built with my patients and their families. So when I had the opportunity to look into business development, and I was in a liaison role for a acute care rehab, so TBIs, I was able to still use those clinical skills and assess that patient, but also get them the care that they needed. And so much of what we do in sales, business development, operations experience is building those connections. So I'll never lose those skills. I always keep my license. It's just funny because those that don't get that, you made a beautiful point. You know, they just think, oh, well, you don't want to do that. And it's because we love that and you want to capitalize on that impact that you can make. All right. So if you could give one insight to someone who's thinking about stepping from patient care into an administrative role, what would it be?
Don't ever lose your clinical lens. Pull it up, look through it at all times. It's your superpower. It truly is. That clinical lens is going to be what drives everything. And, I know when I jumped in, everyone's like, oh, are you stepping out of your clinical role? And it's like, no, I'm growing in my clinical role, right? I'm still providing care direction, right? Just from a different capacity. So it's not that you're ever going to lose what you're driving clinically, right? Keep that as your foundation and let it just guide your path to everything you do, even in administration role. It's the foundation. It truly is.
What excites you about the future of your work and the ways care and operations intersect?
When it comes down to it, when we get care right, everything else follows. Really, we believe that we provide excellent care through the hearts of our team members. And to wrap this into full picture, I have an amazing group of people that I work with, and they believe in that vision, and they empower it every single day. And because of that, I know we're going to continue to be powerful impact for our residents, for their families, and for each other, right? That's a big part of what we do and why we do it. That's a big part of why I trust in the work that we do, and it's going to continue to do great things for this world.
Well, Brittany, thank you so much for joining us on the Hearts of Excellence podcast, and thank you for making the trek here and being our first official podcast in our new innovation space / Paul's office.
I love it. It's
Sounds
beautiful.
Very cool. We'll have to get it branded for the
Brand it. We're going to have to brand that. But seriously, thank you for being here. Wonderful conversation. And I know it's going to be the first of many conversations that we have. And Paul, as always, thank you for leading with empathy and with heart. And this is a perfect example of you just welcoming the world into your space with open arms.
Well, I am more than blessed the people I work with. I am truly blessed and honored. I'm just one piece of a cog that we all work together. And it's just, we're very blessed that they're starting to all interlock, because at the end of the day, I get to go home to my family. Our residents don't. So that is their family, that is their home. So how do we make it the best that we can possibly make it for them? Whether it's the start of their journey from a rehab side, they're coming in through that really difficult time where they never thought they were going to have a stroke, have a hip fracture, to the journey of it's their final leg. Yeah. They're on their journey to whatever destination they believe in, but they're on their journey home, wherever home is for them. So I just think it's such an honor that we get to do it, and I get to be part of such a great organization. So I'm very blessed.
Well, to our listeners, thank you for listening to Hearts of Excellence. To learn more about working at Majestic Care, visit majesticCare.com/contact us. If you or a loved one needs long-term care or short-term care, assisted living, or memory care, please reach out to us and discover how we can support your next chapter. Thank you. Thanks for listening to Hearts of Excellence. To learn more about becoming a care team member or how we can support your loved ones, visit majesticCare.com. And don't forget to follow and share, because every story deserves to be heard.